All right, so we know if a cavity is small enough, we can reverse it. But for somebody who has gotten to a place where that is now gotten big enough that reversal isn't an option, and they've decided to go for a filling, what is good, better, and best for materials to use for that?
Well, okay, so I use a laser for my fillings at my office because it is it's a lot more gentle on the structure. So if you can find a dentist doing laser fillings, I would suggest that as opposed to a drill. But again, you may not have access to that. From a filling standpoint, I would absolutely refuse any mercury or silver fillings. Those actually have been banned in the EU. I believe they have until January 1st of this year, so it's very soon. Of course, we haven't done that yet here in the US, although the CDC has come out saying to be very cautious with mercury in children and people who are pregnant and people who are sensitive to mercury, which I believe, last I checked, everyone is sensitive to mercury. So I think that's just a way they were protecting themselves. But I will see, maybe that will get banned. But if you need a new filling, I would not put the silver in there. If you have an existing filling, don't panic. Work with a biological dentist to see what your options are about maybe having them removed or replaced when necessary. I use ceramic-based materials for my fillings and my sealants. So they're the cleanest on the market. And so they're plastic free. I think the next best bet, if you can't access someone using ceramic-based filling materials, would be just making sure they are BPA and BizGMA free. And there's some that they're still plastic focused, but they do have kind of the bigger culprits taken out, if you will. But, there's still going to be some plasticizers in there. Yeah, I think those are your options, really, and then also just knowing you can only do what you can do, and so if these aren't options to you, it will probably be okay. Just you need the tooth fixed. You don't want to be in pain. You don't want to lose the tooth. So get it addressed so it's stable. And then knowing maybe in the future you can have it redone with a more optimized material. But I don't think, one filling is going to be what's going to, tip you over the edge. Essentially, it's everything that adds up. It's the rain barrel effect, right? So it's all those toxins and exposures over time. And so nothing can be perfect. And then when we start thinking that way, that's where I see so much anxiety and mental health issues in our patients too, because it is also overwhelming. So just try to set realistic expectations and say, you know what? I only had access to this one dentist. They only had this filling material. I need to fix my tooth, but I'm going to really double down in some of these other areas to avoid exposures and maybe my beauty makeup products, or maybe in my kitchen, I'm going to clean up my kitchen more. I'm going to stop buying bottled plastic water, things like that.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
Something that quite literally keeps me up at night. I'm very worried about it. I think it's a global epidemic. Not many are speaking about it. It's something called enamel hypoplasia, or it's basically undermineralized enamel.